Hello friends, solving reasoning type questions is a little difficult at the first year level because so far you were dependent on the notes and just rectifying those notes and writing them in the exam. These questions require certain analytical mind. So we are starting a new section on our channel which will deal with the reasoning type questions. Let's see what this question is. Mitral stenosis patients have a lower probability of suffering from tuberculosis. At the first look, it doesn't appear to be connected. Mitral stenosis, tuberculosis. Let's find out. First point that you should know is that the tuberculosis bacillus, the bacteria of tuberculosis, is a strict aerobe. That means it thrives, it survives and thrives and grows under the conditions of aerobic nature, means in the presence of oxygen. It needs oxygen to survive and thrive. That's the point number one. And the second point that you should know is that tuberculosis focus, the lesion of tuberculosis or the focus of tuberculosis, is most commonly found in the apical region of the lungs. Let's find out why. Look, apical region of the lung is above the level of heart. That means when the heart is pumping the blood and the blood is going towards apex, apical region, it is going against gravity. And since the blood is going against gravity, in the apical region, the blood flow is less, relatively less blood flow and less pressure in the vessels, pulmonary vessels at the apex. Less flow, less pressure. I'm talking about the blood flow. It means what? It means when you inspire oxygen, atmospheric air inspired, oxygen inspired, in the apical region, since the blood flow is relatively less, that means diffusion of oxygen from the alveolus to the blood will be relatively less. Blood flow is less at the apex. Means what? The alveolar oxygen which you have inspired and it has reached alveoli, its diffusion into the blood would be lesser. That means more oxygen will remain in the alveoli at the apex. More oxygen will remain in the alveoli at the apex because those alveoli have relatively less blood flow because the blood is going against gravity. And we also said that tuberculosis bacillus is a strict aerobe. Where there is more oxygen, it thrives. So if the tuberculosis bacillus has been inhaled, it is more likely to stabilize and grow and thrive at the apical region. And therefore remember, because of the less blood flow at the apex, oxygen could not be picked up from the alveolar air. That means more oxygen stays in the alveolar air at the apex, and therefore tuberculosis focus is also commonly found at the apical region. Now that being said, what's with the mitral stenosis? Now that's interesting. Mitral stenosis. Now you know what is stenosis. Valve orifice is narrowed and the valve leaflets adhere to each other, which means that blood cannot go properly through the stenosed valve. Now consider here mitral stenosis. Blood cannot flow from left atrium to left ventricle through the stenosed mitral valve. That's the basic abnormality in mitral stenosis. And because of the stenosed valve, the chamber behind the stenosed valve has to perform extra work, or it has to contract more strongly to send the blood through the stenosed valve. In this case, in the case of mitral stenosis, it is the left atrium. The burden on the left atrium will increase in the conditions of mitral stenosis because the valve is stenosed. So there is left atrial hypertrophy, burden on the left atrium. It cannot send the blood normally through the stenosed valve, and as a result of that, as it starts contracting little stronger and stronger, but still some amount of blood stays back in the pulmonary blood. Some amount of blood stays in the pulmonary vessels. You know, pulmonary vein drains into the left atrium. So now here, left atrium is already overburdened. It is contracting stronger to send the blood through the stenosed mitral valve. It's not happening normally. So blood is accumulating in the left atrium and then it starts congesting backward. There is engorgement of blood in the pulmonary vessels. Engorgement, congestion of blood in the pulmonary vessels. So what will be the result? There is increased blood in the pulmonary vessels, and that includes the apical region. So more and more blood in the various regions of the lungs, including apical region. More blood flow. Now you can make the connection. At the apical region, tuberculosis bacillus was thriving because of the less blood flow. And now increased blood flow in the lungs or increased amount of blood in the lungs because of this peculiar condition, mitral stenosis, left atrium not able to perform its function properly, blood is accumulating in the left atrium and then getting congested backward and backward. So more blood accumulates in the lungs. More blood in the lungs means now it can pick up oxygen from the alveolar air. Remember what we said some time back? Because of the less amount of blood flow, particularly in the apical region, more oxygen was remaining in the alveolar air. Now the blood flow has increased, the amount of blood has increased. That means it can pick up more and more oxygen from the alveolar air. That means now oxygen content in the alveolar air will reduce, and therefore the chances of tuberculosis bacillus surviving and thriving in these regions, particularly apical regions, will also be little less than usual. So that was the reasoning and the explanation that in the patients of mitral stenosis, the chances of tuberculosis as a full-blown disease are little less compared to the other normal individuals. So we will discuss more such interesting cases or interesting reasoning type questions on our channel. So it will be a good idea to subscribe to the channel and hit the bell icon.